Depart Process Module 6. The hospital-wide depart process provides a concise, efficient way to complete related discharge functions for your patient. The completion of depart documentation is a shared responsibility between provider and nurse and results in the patient leaving the hospital with a printed summary of the visit. Included in the summary will be a discharge diagnosis, vital signs and pain assessment at discharge, medication instruction, patient education, and follow-up information. To initiate the depart process, click on the depart icon located in the toolbar at the top of the page. The left side of the screen displays a list of the individual actions making up the depart process. As we stated earlier, the depart process is a shared responsibility between you and your patient's provider. As the nurse, you are expected to complete patient education, vital signs, pain assessment, patient belongings checklist, nursing discharge information, and the patient partner discharge education. Each of the required components can be accessed by clicking the pencil and pad icon on the right. The first section to be addressed when completing the depart process is patient education. This is a shared responsibility between the provider and the nurse. You may notice an alphabetized list of suggested education in the depart menu based on your patient's diagnosis. Should you choose to include the suggested education in your patient's discharge paperwork, place a check in the box next to the corresponding topic. As discussed in Module 2, our patient was identified as a candidate for the pneumococcal vaccine. Scroll down to locate pneumococcal vaccine indicated. Place a check mark in the box on the left to include this in the patient's discharge paperwork. To add additional instructions, click on the pencil and pad to the right of Patient Education. Educational topics are filed under specific folders for your convenience. Click on the All folder and type a keyword into the search box. A list of topics related to the keyword displays. Double-click on the topic to add those specific instructions to your patient's discharge paperwork. Click Sign when finished. The next section the nurse is responsible for is the Vital Signs section. Click on the pencil and pad to the right of Vital Signs. This will open a Power Form to document vitals in. To add the patient's vital signs, click into each box that applies. For example, if your patient's oral temperature is 36.8 degrees Celsius, click in the oral box and type 36.8. The next vital to document is the patient's pulse rate. If you obtained the pulse rate peripherally, then you would click in the peripheral pulse rate box and type 85. The patient's blood pressure will be separated by two boxes. The first is for the systolic blood pressure and the second box for the diastolic blood pressure. Type in 120/80. Your patient's respiratory rate is 60. Type 60 in the box next to respiratory rate. Next, you will notice a box labeled O2 therapy. In this box, you will see multiple answers with boxes to the left. This is a multi-select box. You may choose as many responses to the question as needed. For training purposes, let's place a check next to room air. Lastly, document O2 saturation 100. Once all the vital signs have been documented, click on the green check mark in the upper left-hand corner to sign the Vital Sign Power Form. Moving down the Depart menu, there are 5 other nursing sections to complete in the Depart process. They are Pain Assessment Universal, Patient Belongings Checklist, Transfer Details Form, if applicable, Nursing Discharge, and Patient Partner Discharge Education. Since PowerForm functionality is covered in an earlier module, it will not be necessary to cover each form individually. Please refer back to Module 2. Please note the preliminary cause of death documentation is a provider responsibility. It is not a nursing function. The last section in the Depart menu is labeled Depart. This not only functions as a final checklist for the Depart process, but allows you to select a reason for overriding a required element. This functionality is also referred to as Depart process gap checking. Click on the pad and pencil icon. The incomplete elements will display. Use the drop-down to select an override reason. You must complete an override reason for each element listed before clicking OK to close the screen. There are 3 final actions left to complete the Depart process. The first is to indicate that the patient and/or caregiver verbalizes understanding of all instructions. Check the required box next to that statement at the bottom left of the screen. The second action is to sign the completed Depart document using the button in the right bottom corner. Finally, you will print the document to provide the patient with a completed summary of their visit. Should the patient request a CD copy of their instructions, check both boxes in the left-hand bottom corner. Contact HIMSS to process the request. This concludes Module 6 and our video, Cerner PowerChart Documentation for Nursing.